Good afternoon and a warm welcome to our audience. I'm Dr. Madhu Smitha from 2050 Healthcare. We have all heard of the word epilepsy and know that it is a disorder of the brain. For many of us, it is a disease that happens to others and can be kept on the back burner. However, did you know that epilepsy affects approximately 12 to 14 million people in India alone? And most families miss the first signs of a seizure in children or probable epilepsy diagnosis due to lack of awareness. Thus, despite the prevalence, a significant treatment gap remains, leaving many without access to essential medical care. Today, we aim to shed light on this pressing issue and explore solutions to improve the lives of those living with epilepsy. As we gather here, we recognize the significance of raising awareness about epilepsy. Join us as we delve in the complexities of epilepsy and explore the latest advancement in treatment. Let us unite to educate, support, and advocate for those impacted by this neurological disorder. I saw you walking. You come from Regal, right? What is that? We As we gather here, we recognize the significance of raising awareness about epilepsy. Join us as we delve into the complexities of epilepsy and explore the latest advancements in treatment. Let us unite to educate, support, and advocate for those impacted by this neurological disorder. Today, we are privileged to have Dr. Ramnarayan with us, a consultant and functional neurosurgeon at Lakshmi Neuro Clinic in Chennai. With over 23 of experience, Dr. Ramnarayan has achieved numerous accolades for his contributions to the field, including the Gold Star Millennium Achievers Award and the Best Doctor Award from Dr. MGR University, Tamil Nadu. He specializes in treating brain cancers and will provide valuable insights into epilepsy care. Welcome, sir. To begin the session, if you could let us know what epilepsy is and what are the methods used to diagnose it.
The epilepsy, of course, I'm sure every one of us has seen epilepsy. It's a brain condition. So, the brain works by producing electricity, and this electricity is used to control the various functions of the body. In some people, there is excess electrical activity, and this causes what is called seizures. Seizures are of various types, but most common, which we see on the roads and all that, is people having these seizures like this, tonic-clonic seizures like this. There are many types of epilepsy, and in some people the causes can be identified, but in most of the patients you cannot identify a cause. And it is estimated that about 1 to 2% of the population in the world has epilepsy. So it's a huge number. So it runs into probably hundreds of billions and all that. There are various things which I want to mention about epilepsy. There's something called what is called aura. That is, there are some people who know that they are going to get an epileptic attack. So what they do is they go and lie down, quietly lie down and all that. Otherwise, if they suppose they are standing, they may fall down and have injuries to themselves and create problems for themselves and others. But it doesn't. In some people, it doesn't happen. Then in some people, there's some, especially in children, where they just stare like this. I remember in one of the, not now, but some years back, there was a boy who was, repeatedly staring at a group of ladies. And it became a big issue. One of the lady went and slapped him. Then, this fellow didn't know what is happening to him. So then I happened to be in the same train and I asked them what is the problem. Then they said this fellow is misbehaving with ladies and all that. But then, when I went to the history, it is not he is doing it, is epilepsy. Then I told these ladies, you should have been more careful. You should not have done slapped him. He can take you to court. He can sue you for creating the, physically assaulting him when he has a medical condition. So these things happen. All this can happen. And, it has got a lot of social problems also. And I'm sure, as a young lady, there are at least some ladies who don't get married because of being an epileptic. It's a sad story, sad situation. Okay. Basically, epilepsy most of the time is diagnosed only by clinical history. Because, a majority of the patients, in between the attacks, they are normal, just like you and me. You can't say that somebody is epileptic just by looking at it. He may be working, he may be traveling, he may be playing cricket. All this he can do, but he may be epileptic. So, and the most important during history is, if possible, get an eyewitness account. because eyewitness account plays a very important role in diagnosis. There are a lot of symptoms which are very common. As I always said, the tonic-clonic seizures with tongue bite and all this is probably the common. But again, staring is very common. There are people, in fact, I know a medical representative who was very, very well respected because of his way of behaving. Suddenly, he started misbehaving with all dogs. Then people started ignoring him, but later they found out that he's having what's called temporal lobe epilepsy. So behavioral changes. So many symptoms happen, and then some people just fall down to the ground, are unconscious for some time. Children, they have a different presentation. They get what's called absent seizures. They are blank for a few seconds. It's very variable. A lot of symptoms are there. And then, as I said, the late temporal lobe epilepsy. This is a very common problem. And they are normal, but suddenly they start misbehaving. Okay. And there are different types of epilepsy, but the main commonest varieties which we can classify is one is focal epilepsy. That is only one hand or one side, one hand and leg, only mouth, or it can be generalized, where it can be happening in both sides. And usually generalized seizures, people are not conscious. Then another common thing is, it starts in one side and then goes to the whole body. It becomes, we call it focal becoming generalized. And then there are various other types of epilepsies which are, people are not, still there are a lot of gray areas in these things. We do not know the exact cause of epilepsy, but then definitely there are some causes which have been identified. Genetic causes, especially a parent having an epilepsy increases the risk. Metabolic causes, especially in the elderly people nowadays, because especially in some places, like say, for example, in our place in Chennai, it's a hot climate, we sweat a lot. And elderly people, and there's a misconception that if you take too much sodium, you would become hyper BP patient. So they take less salt. So less salt, more loss in the sweat and all that. They develop conditions like hyponatremia, sodium becoming low in the zinc. That can cause seizures. Then there are brain conditions like medial temporal sclerosis, vascular malformations. Then in children, especially in newborn, which you see in the neonatal ICU and all that, is a lot of children develop bleeding into the brain. I'm not going into the causes of this, but they develop bleeding into the brain, and this can cause seizures. Brain tumors, obviously, is one of the commonest reasons for epilepsy in many patients. And then infections, encephalitis, meningitis, all this can cause infections. But there's one condition called febrile seizures. I'm sure you've heard of this febrile seizures. This usually happens in young children between the age of 1 and 6. And usually, after the age of 6, it doesn't recur. This happens when the children have very high temperature. That is, it is more than 102 degrees. The children get an episode of seizures. And, it's quite common. It's quite common. In fact, if between you and me, and if you will not talk outside, even I had febrile seizures when I was a child. But usually it doesn't progress. By age of 6 or 7, it stops and it doesn't progress. Some children, yes, it does progress, but it's very uncommon to progress. How do you manage this problem? I'll just put now, because, a lot of mothers, young mothers may be really concerned about this. The commonest way you manage this condition is to ensure that the fever does not increase. There's a mechanism they say is the fever is creating trouble for the immature brain. Children, the brain is not till mature. The best way is to control the temperature by various methods. Every mother knows how to control their children's fever, including medications. In some children who are getting this, in spite of this, we need to start them on medications. Drugs we need to start them on. Then the other question which a lot of people ask is, what can trigger seizures? Seizures, there are a lot of things which can trigger seizures, to be honest, watching some of this, film fair shows can trigger seizures. There's a lot of flashes of light which can. In fact, I tell people with epilepsy and with migraine, don't watch this type of TV shows, because, they can really cause, and they can precipitate an attack of either epilepsy or migraine. Then, still, with all this, the commonest reasons for recurrent stroke is the recurrent epilepsy is the patients not taking the medicines properly. So whenever a patient comes to us with a history of having repeated seizures, the first question we ask them is, are you taking the medicines correctly? We check and cross-check with even the parents to ensure that they are on the medicines correctly. Then, in some people, sleep deprivation, addictives like alcohol, as I said earlier, flashing lights, and unfortunately, in some young women, monthly cycles can cause this. Missing meals, all of this can cause seizures. There's no, but nobody knows why. In some people, of course, we all miss the seizures, but most of us don't get seizures. We all have, seen this flashing lights. We don't get seizures.
Thank you, sir, for the answer. The next question for you is, can epilepsy be cured or is it a lifelong condition?
See, can epilepsy be cured? Yes and no. Yes means, there are some conditions as I explained earlier, like say, for example, a brain tumor causing epilepsy. If you remove the tumor, there's a good chance that you can cure the epilepsy. The epilepsy may not come back. No, because in most of the people, you cannot find out a cause for this epilepsy, and also they may not be cured, then may need lifelong treatment. So that's a problem. It depends on what causes epilepsy. And unfortunately, in a good majority of the patients, it's unfortunately a lifelong condition. So they may require to take the medications for a long time. But what we generally do is we ask them to take medicines for 5 years and then try reducing the medicines. If it works, we just keep them off the medicines. But it is a trial and error.
So the next question for you being, how do you diagnose it and the treatment options available?
Okay. See, obviously, once you make a clinical diagnosis, you have to substantiate your diagnosis, because the problem with epilepsy is, as I said earlier, when the patient is coming to you, he is normal. He's probably better than you and me. So you do not know. Your clinical examination will not produce anything, and so you'll have to substantiate it with other investigations. So basically, just like other conditions, we always do some blood tests, like as I said earlier, we test for sugar, sodium, calcium, all these blood levels we do. Then other usual blood tests. Then the usual investigations done for epilepsy is one is what called EEG, that is electroencephalography. That is, we put multiple electrodes into the brain and record the brain activity. The brain activity will, in patients who are prone to epilepsy, the EEG can be abnormal. And this is an indication that EEG is abnormal, that the patient has a tendency to have a seizure anytime. That the other, in some patients, actually, there is this is a funny world. A lot of them are better actors than many of our own big Hollywood stars. There are, people who can mimic epilepsy just like a normal person. In fact, last week I had one man who came with a movement disorder. He's like this. He's always like this. He has seen by more than 100 doctors. Nobody is able to diagnose. Finally, it turned out to be a functional disorder. He's acting it out. Similarly, epilepsy is very common. A lot of young people do act it out for various social reasons. So we always do what is called a video EEG. That is, we do a video along with the EEG for 24 hours, 48 hours, so that whenever the video shows epilepsy, the EEG should record. Otherwise, we will take it as a false record. It's not a good proper epilepsy. Okay, then we always need to do CT scans and MRI to see the structures of the brain, whether there is any blood vessel problem, whether there is any medial temporal sclerosis. All this need to be ruled out by scans, MRIs, and this thing. And in some patients, especially in children, as I said, infection could be a problem. So we sometimes need to do what we call a lumbar puncture. We have to put a needle into the spine, into the CSF, and take out and send the CSF for analysis. So these are the usual common tests, and usually by these tests we get a good idea of this. Some people, especially when we are thinking of surgery as an option, we may need to do PET scans, SPECT scans, and all that. But this is not for everybody. Then, answering your other question about the treatment, obviously we need to treat this condition because it's a very, very distressing and very, very, so it's a big problem. So there are, just like most of our diseases, we have got a medical management, we have got a surgical management. So I will first go through the medical management. There are a lot of drugs which are available in the market, which are freely available, and which are very widely used and have been very effective for millions, or rather billions, of people all over the world. There are two types of medication. One is we call the older generation ones, and second is the newer generation ones. I'm not going into the details because there's a big list. I'm not going into the big list because of lack of time. But the older generation drugs like phenytoin, tegretol, and valproate are been used for a long time. Whereas the newer drugs like levetiracetam, lamotrigine, freezing, clobazam, so many. So these are the new medicines. Of course, obviously one thing will come to you. One question will come to your mind: why? What is the difference between the old and the new? The reason is, the studies have shown that newer generation drugs have both better tolerated and much more safer compared to the older drugs. That is the reason why people prefer the older drugs. But the older drugs are, as you know, it's time tested. It's been there for years and it has helped in millions, billions of people. So it's a judicious mix. A lot of people give some old drugs, some new drugs. They give a combination of both. So it's a personal experience and personal thing of the concerned clinician. But unfortunately, there is something called treatment-resistant epilepsy. That is treatment-resistant. It becomes resistant to treatment, and this forms about 30 to 40% of the patients. So in these patients, you have to give more than one medicine, two medicine, three medicines. Sometimes none of this work, and obviously, when the side effects of the drugs will come in. So the usual standard, what we do is, if patients are getting refractory repeated seizures in spite of being on 1 year of full therapy with adequate doses of minimum 2 drugs, then we call it a treatment-resistant epilepsy. I will repeat that again. That is 1 year of therapy with adequate dose of minimum 2 drugs. And most important is, we have to ensure that the patient is fully and correctly taking the medicines, because then it becomes an exclusion clause. If the patient is not regular with medications, obviously you cannot call it a treatment-resistant epilepsy. Okay, so these patients we offer surgery. There are various surgical options which can be given, and these options are usually these are very, very common nowadays, because a lot of people are getting operated nowadays for epilepsy. What are the types of surgery? I will explain. One is, of course, there are 3 types of surgery. One is what we call resective surgeries. That is, you resect or remove portions of the brain. Second is what we call stereotactic radiosurgery, where we use radiation to destroy particular areas of the brain so that they won't have any, they don't cause or trigger seizures. And third is neuromodulatory treatments. So I'll just briefly go through each of one. Resective seizures means, you find out that a patient has a problem here, there's a blood vessel here which is causing the problem. You resect that out. Or, as I said earlier, there's something called temporal lobe epilepsy, where the temporal lobe, one of the lobes of the brain, the medial portion, the inside portion of the temporal lobe is a culprit. There's always something called medial temporal sclerosis. You can remove the temporal lobe, and of course, there are criteria. Just that you can go in and remove something. I'm not going into the technical details. You remove that thing. Then there are some other surgeries, of course, usually not very common, but these are the older surgeries, but they are usually very mutilating, like corpus callosotomy. They are cutting and removing big portions of the brain. Nowadays, I don't think people practice this, because they are very destructive and very not a good things. Stereotactic radiosurgery, I'm sure people have heard of radiosurgery. Even though it is called radiosurgery, there's nothing surgical here. Here you use pinpoint radiations to destroy various parts of the brain. This is used in various conditions, including tumors and all that. You can pinpoint it very accurately so that the surrounding brain doesn't get affected. But the problem is, again, recurrence is common. It's not 100% accurate. Second thing is, it can affect the rest of the areas of the brain, radiation injury. So children can be affected in a big way in future. The third thing is neuromodulatory. In fact, I want to say one point here. The 2 methods I mentioned, that is resective surgery as well as radiosurgery, are useful only if you say, yes, this is a point which is causing the seizure. You cannot obviously, cut and remove multiple areas of the brain, or give radiation to multiple areas of the brain. So this is a disadvantage of this earlier 2 treatments. So in those patients where you cannot pinpoint a particular area or a particular site where the seizures are triggered, you use this neuromodulatory methods. The usual neuromodulatory methods are vagal nerve stimulation, deep brain stimulation, and responsive neurostimulation. I will not go much into responsive neurostimulation because it's not available in India. The other two are usually very well available and has been used by a lot of people to help a lot of number of patients. I'm sure all of us have heard of the vagal nerve. It's somewhere here. It goes from the neck to the heart and the kidney, the intestines, all that. We can put a stimulator on the vagus nerve here and put a battery here in front of the chest, and we can stimulate. And this is a very well known and internationally approved surgery for uncontrolled seizures. It is very good for focal epilepsy. That is, when one side is affected, and it's quite effective. Very simple surgery, and as I said earlier, it's internationally approved surgery. But the disadvantage is that it does not 100% control these seizures. It can only reduce the incidence of seizures. Suppose somebody is getting 4 seizures in a month, we can make it 1 or 2. That is all. So problem is, sometimes we cannot take the patients off medications 100%. So they will have to continue with the medication, and then they have to undergo the stimulation. The other surgery which we are doing in India is what's called deep brain stimulation. That is, we put electrodes into the brain and put a battery in front of the chest and we stimulate. This is also internationally approved, and it is a very simple surgery. It's a pinhole surgery, and it's very effective. In fact, it's much more effective than vagal stimulation. But the disadvantage is that vagal stimulation is a much less risky surgery, whereas here it is a more risky surgery. This is also an US FDA approved procedure. In fact, not only US FDA, Canada, UK, so many countries have approved this procedure, and India also it is an approved procedure. So this is a brief overall of the treatment schedules that we. So I think it is quite clear, no?
Yes, sir. So, of course, being epilepsy being one of the most common neurological disorder in India, still, if we see, there's a lot of stigma around it. So, how do we, strategize to address it and elevate the stigma which is associated?
Yes, this is the saddest part of the whole story. As we said earlier, in fact, I had a boy who, from a very poor background. His parents were farmers, usual, and very common in India, in our country. This boy was, getting a good amount of money by this Swiggy. Sorry for naming the company, and nothing against any company. He was a, he was a sort of courier boy. He used to give food to, deliver food. Unfortunately, he was epileptic. He was on medication, but one day what happened is he did not have the money to buy the medicine, so he skipped 1 dose. He had epilepsy, and unfortunately, the company terminated his service. So I had to intervene and talk to them. And sometimes I feel whether I'm a doctor or a broker, because many times I have intervened for young ladies who don't get married because they are epileptic. I am forced to call the parents, or the prospective bridegroom's parents are called and explained and all that. And so I sometimes think I even change my job like that. So this always happens. It's a very, very socially very stigmatic problem. Obviously, what happens is, people don't talk about it. People lie about it. They don't, and if they don't talk about it, creates more problem. Because, if you are sitting in our office and you get an epilepsy fit, you become a subject of ridicule. You become a subject. It's a very, 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 very negative situation. Very negative situation. So we need to do a lot of work, especially people like you need to do a lot of work to create the awareness. And even, in fact, there are some doctors also who are not aware. In fact, I had to counsel a doctor, husband, wife, and the groom, all doctors, regarding a young doctor lady who had epilepsy. Even our own medical professions have a lot of misconceptions. So how do you get over these problems? Because the most important is, health education, where people like you who are very active in social media, people like you can, of course, people like me also need to contribute. So together we should contribute and bring out a lot of things, saying that just like any other disease condition, this is also one condition. It's not even a disease. This is a state, this is a condition only, not a disease. And people can have a normal, perfect life with this condition. Only thing is they will have to be on proper treatment. And then, there are, of course, in India, we don't have much facility, but outside India, we have got all these epilepsy foundations and things like that, where people come together and, they do all these free sessions for caregivers. It's a community effort. The community definitely needs to make a lot of effort. Then the other important thing is the patient himself has to learn that this is not a very serious problem. It's one of the many problems. For example, there are so many people who are diabetic. Many of the successful CEOs whom I know are diabetic. So what? That are not prevented them from even skipping work even one day. I'm sure you also know many high-placed individuals who are diabetic, but it doesn't matter. So like diabetes and all that, this is another condition where people can be on medications, have a normal, very very perfect life. So but they have to be coming forth and seeking treatment, discussing the problem and all that. And then I have started doing one new thing, that is I'm requesting patients who come to me, especially because surgery people who come to me, I'm requesting them to write about their stories on the various, now we have got a lot of educational materials. So I'm asking them to write their stories. There's a WhatsApp group also where, everybody talks about his or her experience. So the message gets around. So these are the various ways by which we can treat the stigma associated with the disease.
Thank you, sir, for the answer. If you can also tell us a little bit about impact of epilepsy on driving.
Yeah. See, of course, driving also always is a lot of restrictions on driving for various conditions. Okay, and the epilepsy is one among the list. There are different rules in different countries, but I will talk about what's the situation in India. So actually, we are some of the rules in India. Unfortunately, we are still following the British era rules. And the latest act in India is Indian Motor Vehicle Act, which was passed in 1939. That act actually empowers the transport authorities to deny driving license to anyone who may be an epileptic, even though he's on treatment and fully under control. And second thing is, they have not changed the rules, but they have just added some clauses where people have to, the physical fitness form, the driving license, you have to add that you are not epileptic. And, you can be penalized severely if they later find out that you have, made a false declaration. Also, if you're epileptic, you have to go through a separate set of tests, even go to the neurologist and all that, and have a detailed assessment. But in India, compared to many other countries, the rules are not so tight. So some people do get license and do drive, but it always has a risk, especially if people are not on proper medications and they have always a chance of getting a epilepsy, a seizure. Then it's better that they don't drive. That is but in some countries, for example, I operate in the Middle East, and Middle East, they are very strict. They don't give. They just don't give. If you are epileptic, they just don't give.
Thank you, sir. So, we know that diagnosing epilepsy in children is one of the major issues in India as well, because parents are not aware of the situation and they do not realize that they need to visit the doctor. So, if you can tell us a little bit about the impact of epilepsy on children, I think that will be great for the audience.
Yeah. I mean, this is important. A good question, actually, because epilepsy is equally common, I would say, in children as compared. In fact, more common in children than in adults, I would say. Of course, I don't have statistics to support me, but that's what the general feeling which most people have. And obviously, for the parents, it's really alarming. So obviously, it affects the brain, because in children, we all know it's a growing brain. And growing brain, any insult to the growing brain is going to affect the child in the short term as well as the long term. This is because, as you know, the epilepsy itself happens because the brain is a mass of wires and electricity and all that, as we described earlier. And then if there are surges of electricity, for example, if there's a surge of electricity in your house, your TV can get damaged, your air condition can get damaged. Like that, if there are surges of energy into the brain, various parts of the brain can get damaged. And this can definitely affect, higher learning. Some children's speech can get affected. Definitely the cognitive function definitely will get affected. So controlling seizures in children forms a very, very, very important part of the parents' responsibility. Unfortunately, the drugs also can cause a lot of havoc. There are a lot of drugs which cause, in fact, some of them can even cause abnormal behavior, aggressive behavior, and all that. But then it's a devil and deep sea situation. You cannot let go. You have to treat it. As doctors, we generally try to give them the least toxic and the most productive drug for that particular age group. And then in children, other thing which we, of course, not necessarily in children, the other thing which we have to remember is some drugs like valproate, which has known to have effect on the growing fetus in pregnant women. So the other thing which as doctors we tell a young woman, if she is recently married or she is planning a baby, we always tell them, if you are planning a baby, come back to us, we will change the drug, put you on a new drug, then only you try for your baby. So this is important. Some drugs can cause problems for the fetus also. So this two are important.
Thank you, sir. I think the parents will be more relieved to know about it and better diagnose, not diagnose it, but at least they will be aware of the situation and visit a doctor accordingly. So, also moving on, we have seen that lack of sleep is one of the major issues in the industry as of now. So, does sleep deprivation also lead to epilepsy or trigger epilepsy? More to it.
Yes, yes, it does. In fact, sleep deprivation and driving with, trying to suppress your sleep and driving. In fact, I would think that some of the cause of road accidents is people getting an epileptic attack when they are driving without sleeping for a long time. It's a major problem. Again, even some people, I do know one particular doctor, young male doctor, who got multiple episodes in one particular night because he had to stay awake the whole night one day, and again the second day night also because there was some problem. Some his colleague went on some problem, some duty problems. He was on the second day. By the second day morning, he was having continuous seizures. So it's common. Even in normal people, you can get. So if you're already an epileptic, it's better to try to get a good night's sleep every day.
Thank you, sir, for the answer. So, moving on, do you think rehabilitation plays a role in epilepsy management? And if so, what is it?
Yes, 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 yes. Because epilepsy, as we discussed earlier, has got both a disease problem as well as a social problem. So rehabilitation has definitely a big role. And then there are various steps we have to do, and I'm not going to the it'll take a long time to describe in great detail, but I'll just touch the salient points. Most important again and again and again is seizure control. In fact, I will say the most important 3 points if you ask me: seizure control, seizure control, seizure control, for various reasons which you already described. Then in some people, they may need, some of these people may have mental development disorders and all that. They may require other therapies like, speech therapy, occupational therapy, other supportive physical and cognitive rehabilitation they may need. Because some of this, especially children who started having epilepsy when they were very young, very small, due to some infection and all, I'm sure all of us see this type of children also, this type of patients. So they require a lot of therapies like physiotherapy, occupational therapy, and all that. Then both patients as well as their parents or caregivers, they do require a lot of emotional and psychological support because more not because of the disease itself, but because of the social connotation. See, as we described earlier, if your daughter is epileptic and she reaches marriageable age, many parents are really scared and they're stressed out on that. So they require a lot of emotional support. And then, we need to educate patients. As we said earlier, one of the easiest ways to control epilepsy is to be well educated about the condition. If you know about the condition, you will take precautions to take care of it. And then so various, getting them good jobs, proper supportive certificates for ensuring that they have a good life is very important. Rehabilitation plays a big role. Of course, in all the neurological disorders, rehabilitation plays a big role. And here it is very, very important. So that, because, in between epileptic seizures, 80 to 90% of the patients are normal and can be highly productive to the society. So it's better that they have rehabilitated comfortably so that they can be productive to the country.
Thank you, sir. The last question for the session for you. If a person witnesses a person having a seizure, what should they do?
Yes, I think it's the last question, but probably the most important. Good. Yes, we all have, I'm sure every one of us, at least in our lifetime, at least once in a time in the railway station or the public roads, bus station, metro station, we do meet somebody who suddenly falls down and gets a seizure. what are the various ways, or what are steps we should do. This is very important for all the public who are, all of us, for every one of us. Most important is when you see such a person, what we generally do, this is like seeing a snake and people running away. When generally, the people with wisdom say that when you see a snake, don't run away. A snake will go, or you see a barking dog, don't run away. It will invariably run behind you and bite you. But if you stay calm, the animal also stays. Here also, epilepsy, a person with epilepsy, if you see him, don't panic. Just stay calm, go near him, keep him protected. In fact, one of the things we always say is we turn them to one side so that they don't choke on their own saliva or their own this thing and all that. Put them to one side, make them comfortable, give them pillow if possible, put them in a place where they're on a flat surface. And if it's a road or something, you need to put them on the roads, side of the road, so that it doesn't create trouble for other people. All these things can be done. Usually, in majority of the cases, epilepsy, the whole episode lasts a few seconds to a minute. Just wait for the thing to the thing. And some people also advise putting a metal piece in between the tongue between the teeth to prevent tongue bite as well as teeth getting injured. So that can be done. And just wait for things. It will settle down most of the time. Meanwhile, get somebody to call the ambulance and shift him to a hospital, nearest hospital, as soon as possible. Of course, there's a old concept which I don't know whether younger people like but in olden days when we were children, they always say that give an iron piece to the epileptic and the epilepsy will go away. That is only a misconception. Iron piece has nothing to do with epilepsy. So that's a misconception. We have the, I think, this point is very important. All of us should know about this. There is epileptic. In fact, in just turning him around, putting him comfortable, most of the times you can save the patient from getting into trouble. Thank you. Thank you very much.
Thank you so much, sir, for taking your time and taking the session. Sir, just to end the session, if you would like to give a take-home message to all the audience members or the community.
Yes. In fact, that is also there. See, as I have been stressing multiple times, epilepsy is not a major, serious, dangerous, serious disease. It is more of a condition. And it is a condition where you can have a good, normal, long, productive, and excellent life without any problems. Only problem is diagnose it properly, get the proper treatment, follow the treatment correctly, and be happy. Thank you. Thank you.
As we have come to the end of our live, we extend a heartfelt gratitude to each and every participant for their active engagement and valuable contributions. We hope that today's insights and discussions have provided you with valuable knowledge and practical strategies that you can implement in your respective fields. We would also like to express a sincere appreciation to our esteemed speaker for sharing their expertise and insights with us today. Your expertise has been instrumental in making this webinar a success. As we conclude, we invite you to stay connected with us for future events, discussions, and collaborations. Thank you from 2050 Healthcare, with you in every step of healing.